Brilliant. Okay, well, I don't know what you know about me, but my name's Karen and I'm over here in Moonee Ponds. And I work in the nursing department in education, nursing education, and I've been at Kangan for about 16 years now. So I'm also a registered Division 1 nurse. So, we're going to be having a bit of a look at burns today. And that's something when I was working in hospitals that I saw children and adults with. And, just to say to you that it's a really, it's hard to see people with severe burns because it's very, very difficult. It's very, very painful, and the healing process is very, very slow. Okay, so, let's just anyway start from there. But it might interest you to know that about 1 million people a year seek medical care for burns. So that's a lot of people, and a lot of those people are children. Yeah, so if you think about that with babies and hot water, with flames, maybe with chemicals, you can imagine that might be the case with children. And it is one of the most devastating things we see in medicine. Doctors and nurses would say that, and probably physios as well, who have to do a lot of work with them. If you think about the burn, we might think that it's just about the wound, but it actually isn't. Burns are very much about not just the physical, but also about them emotionally and psychologically, because it leaves a lot of scarring and it requires a lot of rehabilitation. And, you can imagine if you're in a fire or something that, the trauma, and memory of that event also is going to need help, isn't it? Yeah. Severe burns cause a lot of visible scarring that you can see. You may have seen pictures of people with a lot of scarring, and they can be very thick and very raised on the skin. But the scars you actually don't see are the psychological scars and the scars of pain, because burns causes severe pain. Okay, so that's probably just a little bit of an introduction. Are we all going okay at the moment?
Yeah, that's fantastic.
Okay, I'm not speaking too fast for you?
No.
Okay, just wave at me if I am, okay? So, yeah, hi. Okay, so if I was to say to you, if you wanted to buy a coat, and you saw an ad for a coat, that you could get this coat and it would be waterproof, stretchable, washable, and permanent press, that it would repair small cuts and rips and burns, and that it was guaranteed to last a lifetime. Would you think that actually sounds a little bit too good to be true? Well, I would as a shopper. That would be pretty amazing, wouldn't it, to get a coat that did all of that? Well, do you know what? Our skin is our coat on our body, and it covers your whole body like a coat, and it actually performs all of those tasks for you. So it's pretty amazing, yeah? So look, what we're going to have a bit of a look at today is to understand the impact of burns. I'm going to give you a little bit of anatomy and physiology of the skin, because you can't understand what's happened if you don't know what structures have been damaged. So is that okay? Are you up for a little bit of anatomy and physiology?
Yeah.
So anatomy is the structures of the body. So we're going to have a look at the structures and how skin works a little bit, so that when we talk about the burn, it will make more sense to you, okay? All right, so the skin is your largest organ in your body. So if you think about it, if we spread it out, it's the largest organ that you have in your body. It's amazing, isn't it? If you think about it, you wouldn't think about it properly. I don't think I had, but it's about as thick as a paper towel. and yet it does so many things that you're going to find out. It's very important to us. So the first thing I want to say to you about the anatomy is that there are 3 layers, okay? So, yeah, 3 layers. Someone got a question? No?
No, someone's just entered the room.
That's okay. No worries.
That's okay. You can keep going, Harry.
Okay, so the first layer, so have a look at your skin, okay? And the first layer we're looking at is the outside, all right? The one you can see, okay? And it may not be important to you to know, but it's called the epidermis. So it's your outer layer. And, you know, I'm probably happy for you just to write outer layer, you know. So we'll say outer, middle, and inner, which probably makes it a bit easier than these technical terms.
Yeah,
but this, yeah, the outer layer is the epidermis, as I said. So the thickest part of that layer is on the soles of your feet and your hands. Okay, so if you think about it, it has to be thick because you're walking on it and your hands are touching something all the time, aren't they? Okay, so thickest and thinnest on your eyelids, very thin up here. Within this outer layer, you don't actually have any nerve endings, and nerve endings are what you touch with and get sensation with, or blood vessels. So that happens from below. Okay, so we're just thinking about the superficial layer of the skin now. And the interesting thing about this layer of your skin is it has special cells in there which give us our colour in our skin. So some makes some of our skin darker if we have a lot of them, and paler if we have, well, we have the same amount, but yeah, they grow with sunlight. Okay, so if you're you've got in a hot sunny place and they divide more, you will get darker skin. So they're called melanocytes, and that's just a little bit of an interesting thing, isn't it? But they're in your outer level. Okay, gives skin its colour. Now this second layer, okay, we'll call it the middle one, yeah? Okay, it's actually called the dermis, just for those who are interested. And it's really tough and it's very elastic and stretchy, unlike the outer layer, all right? Now the special thing about this layer of your skin is that there are special cells in there. So if you look at your skin, you can see hair, can't you? Can you see the hairs on your arm there? We all have hairs, yeah? Well, the hair follicle, what the hair grows out of, is in that middle layer, okay? You've got glands in that layer. So you have oil glands that keep your hair nice and your skin soft. Otherwise, you'd be like a potato chip. You'd be very, very dry, okay? So that oil is really important from the glands there. I think you all know that you sweat. So you have, yeah, under your arms, but you probably didn't know, but you actually have sweat coming out of the pores in your skin all the time, okay? Not just in those areas like your armpit. Okay, so we've got sweat glands. And we've got nerve endings for touch, and we've got blood vessels which bring all of the nutrients to keep your skin healthy, all right? So you can see there's a lot of special cells in that second layer of your skin. The other thing that you have, if you look at your hands and your toes, is nails. And they grow up out of that second layer too, and they protect your fingers and your toes. Okay, so pretty amazing, isn't it, that this is happening and going on in your body. Now we come to the third layer, and this third layer is just fatty tissue. Okay, gives us a bit of padding. Some of us have a little bit more padding than others. Okay, but it does keep us warm. And so when we fall on our bottom or wherever, we've got a little bit of padding to bounce off, okay? But it does also keep us warm. Okay. Any questions?
Any questions? No. Are you okay with the 3 layers? Yeah. Took notes about them?
Yeah, so the main thing is just to remember there are the 3 layers, okay? That's important for burns. Now, what does the skin do? Well, it's very important to know what its job is, because if it's broken or damaged, like it is in burns, we need to know what its job is, don't we? Okay, so the first thing it does is protects. So number 1 is protection, and that's its biggest job. And if you look at your skin, you can see that it provides an outer protection, doesn't it? Which means the bugs can't just come into your body. So it's protecting you against bacteria and other microorganisms. Okay, so it's like a first line of defense on your body. Now, the other thing it does is keeps water in your body, doesn't it? Because you've got a lot of water. I think 60% of you is made up of water. And if you didn't have skin, it would all just pour out. So this skin keeps all the water in your body. Now, tell me, if we were swimming in a swimming pool and we didn't have skin, what do you think would happen?
You say that again, Karen?
Yeah, no worries. So think about a swimming pool, and if you dived into a pool and you didn't have this skin on you, what would happen to the water? It would just come, that's right. It would just come straight into your body, wouldn't it? And so, of course, that's not going to work for us, is it? So this skin, when you go swimming, keeps water out. So 2 things. 1, keeps water in the body. 2, keeps water out of the body. The other thing that your skin does, and you know how I talked to you that you've got nerve endings in your second layer? These nerve endings protect you from injury. So have a think about maybe when you're cooking and you go to pick up a saucepan on the stove and you put your hand near your pot, your nerve endings sense the heat, don't they? And so what do? You pull your hand away, yeah? So these nerve endings protect you from getting injured. Okay, so what is a burn then? So let's have a little bit of talk. So now we know a little bit about the skin and how it works. Let's talk about what happens in a burn. Okay, we all good to go with that?
Everyone all right? Yeah.
Yep, okay. So when somebody is burnt, or we call it a burn, there is a lot of tissue damage and cell damage. So we're thinking about the tissues of your skin and those structures that we've just learnt about. A lot of damage to all of that, okay? And I guess different ways we burn ourselves are through scalds, so with hot water. Yeah, hot water.
This is number 2, yeah?
We can also get burns from contacting things. So that means putting our hand or on flames. You know, I burnt myself on an iron one day when I was ironing. And that was like a contact burn. One day I burnt myself on a barbecue and oil jumped off it and burnt my finger, and that was a really nasty burn. So, you know, contact and by hot water. Also, you can get a burn from electricity, from chemicals like acid. Acid will burn your skin. And maybe some of you have had sunburn in the past, yeah? So from the UV radiation on your skin, like sunburn, you can get really nasty burns or just superficial burns, okay? So what happens in a burn is that there are potentially 2 really life-threatening problems if we have particularly a deeper burn, okay? And one of them is all that fluid in our body. If that skin is damaged with the burn and isn't there in a large section of your body, all that fluid will start to come out of your body. So we start to lose a lot of fluid, and that's not good for our body. It can affect our blood pressure and heart. And this can eventually lead to our kidneys shutting down, and people die. Okay, so it can be really very, very life-threatening. Depends how many cells are destroyed, okay? All right? So I guess the first thing that needs to happen then in terms of, someone not dying is if it's a big burn, we've got to get some fluids into them, okay? That's really very important to save their life. So the next thing I'm going to tell you about is how burns are classified. So what types of burns? So let's talk about 3 types of burns. Okay, three types of burns. All right. So the first one we call first degree. First degree burns.
Excuse me.
Or you might think about them as being more superficial burns, okay? So when we're talking about first degree, we're going to talk about that, remember, the outer layer of your skin. So we're thinking about this outer layer, the epidermis, okay? And when we get a burn on our epidermis, it's red and swollen, red, swollen, and we will feel just mild pain, not severe, just mild pain. And the good thing about a superficial burn, if there is a good thing, is that it will heal in about 2 to 3 days. So that's pretty amazing, isn't it? 2 to 3 days if it's just superficial. Now, if it's a second degree, so our second one is second degree burn.
Everyone all right? Everyone okay? Yes.
Yeah. Thanks. What we're going to, yep.
Oh, I've got a question here. Is that all right?
Sure.
Yeah, we just said.
About the 3 days, about when the first layer, if it's gone, that means after 3 days it's coming back to...
Yeah, that's because it's really just only red. Those lower levels haven't been damaged. So it's just that very top layer that's red and swollen. So the skin heals very, very quickly. It's got great healing properties in it if it isn't too deep. Yeah. So the next layer, though, is a bit more of a problem for us because it's second degree, okay? And that injury takes out the top layer, being the epidermis, but it also takes out part of the underlying, so that middle layer that we talked about. And what we see with second degree burns is that the nerve endings, because, you know, we said there were those special structures, these little nerve endings are affected. And so because the burn is touching the nerve endings, it can be extremely painful, it can have a lot of pain. And we will see too that people will then blister, so the skin blisters. Have you all had a blister?
Yes.
Yeah. So you know what that looks like, okay? Now, the thing about a second degree burn is more often than not, it will heal in about 3 weeks, and normally not without any scarring if it's managed well, Okay, so again, it takes about 3 weeks to heal, but if we get good treatment, and we'll talk about that later, it will heal in about 3 weeks. Am I going too slow?
No.
Is this all right? Do you have to run anywhere?
No.
Because I've still got a bit to go and we've been going 20 minutes. Are you happy?
Yes.
Okay, all right. Okay, so I'll go a bit quick. Well, I'll try not to speak too quickly. 3rd degree burns are, okay, 3rd degree, serious burns, full thickness we call, okay, right down to that fat layer. So we call that 3rd degree. And they can look grey, white or black. Not very pretty. And that's because the skin has died.
Can you repeat it, please?
Repeat again.
Grey?
Grey, it can look grey, white or black. And often that area isn't painful because all the nerve endings have died in the burn.
Not painful.
So may have no pain until it starts to heal. Now these burns are life-threatening. They can be if they're very large. People can die. All right. Now they're particularly dangerous burns if you inhale the burn. Okay, so if you inhale a burn, you can, or your airway can close over and suffocate you. So that is an emergency situation.
Remember we did inhale today? Remember?
Inhale, breathe in. Yeah. And, you know, if your throat's closing over, you need an ambulance very, very quickly. So let's have a little talk about the treatment then, okay, of a burn. And no matter what level the burn is, we need to remove the source of the heat, whether it be at home, wherever we are. We must remove the source of the heat. That's the first thing. Generally, we would say cold water, okay, out of a tap or out of whatever you can get it into, a bucket or whatever, to just for 20 minutes while you're perhaps waiting for help if it's severe, or if it's even a superficial burn, just run it under the tap for about 20 minutes. And we don't use ice on deep burns. You might use a bit of ice on a superficial 1st degree burn, but not on a deep burn. Okay, no ice.
Why, Karen? Because can you tell the students why? Because a lot of them use ice as a method to treat burns, but probably they are only superficial burns. But
yeah. Look, my understanding is it's because of the damage to the tissues, and it could, if it's that cold, it could perhaps cause more damage. But so the thing is that we're looking for the cooling in the 1st and 2nd degree. We can actually cool the outer. Remembering in a 3rd degree burn, it's very open. So the cool water, the cold ice is okay on the outer skin, but not if it's a deep burn. It's not. It's going to cause more problems than help. So a bit of ice for a superficial burn, yes, good, but not for deep burn. Okay. Now the other thing you don't do is don't pull the clothing off the burn. Don't pull the clothing off. Okay. Better to put a wet dressing on top of the clothing, because if you pull the clothing off, you might pull the skin with it. Okay.
something on top of it.
Yeah, yeah. Also, if there's a blister, don't pop the blister. Leave the blister because it will heal under the blister. Okay, so don't pop blisters. And if you've got a first aid kit, always get out the clean dressing that won't stick to the skin and put it over the top while you're going to the doctor's or waiting for an ambulance. If it's like acid in the eye, we need to irrigate the eye. So even under a tap, it's okay to put your head under a tap and get the acid out of the eyes. Very important. But if you think this burn, you know, is more than superficial or a deep second-degree burn, you need to call an ambulance straight away. And when in doubt, do that. Don't wait. They'll tell you when they come and they'll assess it for you. What will happen then when the ambulance arrives is if it's a severe burn, they will put an IV into, an intravenous cannula into the arm, and they'll run fluids in to the body. Because remember we said fluids can be lost out of the skin in a burn. So getting fluids in quickly, very important. When they get to the hospital, quickly they will start to clean the burn, and they will put special burns dressings on it. Now, in third-degree burns, which are the very, very deep ones, remember, sometimes they will need to go and have surgery, and they will need to clean out that wound, you know, having an operation and an anaesthetic. And they will take a piece of skin from another part of the body that's healthy, and they will then bring that piece of skin and lay it over the burn, and they will stitch it down or staple it down so that it provides a covering to that burn area. And that's what we call a skin graft. So that's one form of treatment for severe burns. One of the problems with skin grafts, however, is that particularly with children, as they grow, the skin graft doesn't grow with them. So they end up having to have a lot of operations. And so that's really quite traumatic and becomes an ongoing problem. So, yeah. So, but nevertheless, you know, is still a very good form of treatment. The other one that you guys, I think, have been reading about is Dr. Fiona Wood's spray-on skin. Yeah? Just looking for my notes. So they call... Yeah, go on, sorry.
I didn't know how to explain that to the students because some thought perhaps you could buy it from the chemist in a can.
Absolutely. Yeah, look, what they call it is, they call it ReCell. So that's what its name is. But if it was that simple, wouldn't that be wonderful? Yeah. Unfortunately, not quite that simple. It needs to be done in a hospital, okay? And what they do is take a small section of skin, healthy skin from the person, and they take it to the laboratory and they get out of that skin all the cells that are needed to go back into the burn to make new skin, so that the skin will grow in the burn wound. So they do it in a laboratory, okay, and they take those cells and they put it in a spray can, and once they've got the cells, they go to the patient and they spray it over the burn. And generally, that will happen within a week. Yes?
Can I ask some question?
Sure.
That one need to choose the different blood group for the different skin spray?
Sorry, I didn't... There's different types of skin spray? Is that the question?
Yeah.
Oh,
different blood group for
but
the
they
different...
take it from you, though. They take
Yep.
it from you and put the cells back in your body. So your body...
It's your cells.
Your body won't reject
He
it.
never made the maybe like before he never made that one. he take my cell and he make the spray.
Yes.
Yes.
So your body won't reject it.
Okay,
Yes. So just sprayed. It's sprayed onto the burn, and in time that starts to grow into healthy skin. So the benefit, the big benefits that we're seeing from Dr. Wood's, well, what do we say? What she's developed here with this new skin is that it reduces the scarring that people have on their skin from 75% all the way down now to only 4%. So it reduces the awful scars that people would have had with burns. And you've probably seen some pictures or seen people with really nasty skin burn scarring. And the great thing is that in children particularly, as I said, it will grow and stretch with them. And so they don't need to have lots of surgeries like adults do with skin grafts, because often the skin grafts, they need to be fixed because they get all contracted and tight on the skin, okay? So, it's a wonderful invention, this spray-on skin, and they're seeing very good results with it. So I guess the next part of care after they have their skin graft and their spray-on tan is that they need weeks and weeks, months and months, years and years of rehabilitation. And that means they have to do a lot of work with physiotherapists to keep the skin flexing, like bending and not getting all tight, okay? They also need to see other therapists that help them to be able to make the adjustments in their life, at home. And they also need to see counsellors for those emotional scars, because it's just so damaging for people emotionally and psychologically. So that's really the end of my presentation today. So I'm not a specialist in burns, but, as I said, I have looked after many people with them, and these are new treatments now that we're talking about. But I hope that just helps you have a little bit more understanding, of what a burn, what happens when we get burnt, and some perhaps first aid things that you could do if if it happened to you or a friend, someone that you know. But remember what I said, when in doubt, call an ambulance straight away. Yeah.